anatomy is the study of cells and tissues, and then embryology is the study of the development of the embryo and then fetus. Okay, we're going to do a little bit of embryology in the second hour today. If we think about the reason that we look at anatomy, the reason that it's so important as a fundamental topic is it gives us an understanding of the basis of disease. If we understand the regular structures and the way to examine the body and the regular findings on imaging, then we can determine if there's any pathology, if there's any disease process, if there's a tumor, if there's a bleed, if there's a swelling in any of the major body systems. Now we're going to basically use observation and visualization to study, so thinking about different body regions, where is a structure located, what's the name that we're going to refer to that structure as, what action or function does the structure have, and then what course does the structure take. So for example, an artery, where can you injure the artery, right? In order to know that, you have to know exactly how it travels from its point of origin to its distal supply. And then the 3D relationships are important as well. So if I have a tumor somewhere, I want to know what's in front of it, what's behind, what's superior, what's inferior, so that I can know what types of structures would be compromised if that tumor, goes up and gets started. So we're going to take a regional approach, as I mentioned. We're going to study some of the major regions and fill in the organs and structures that are in that region. And some of the musculoskeletal system will be from a systems approach, and that'll be our next lecture next week. Now let's think about anatomical terminology. So it's the large part of medical terminology. Again, this is how healthcare professionals communicate. We use objective language in order to reference different parts of the body. It's clear and it's consistent so that there's no error or room for misinterpretation. A lot of the terms are going to be based in Latin and Greek. And so if you think about the origin of some of these words, like bi meaning two, tri meaning three, this will help us understand the morphology or the way that certain muscles appear, right? If I say that there's a bicep muscles, how many heads do you think those muscles have? 2, right? What about triceps? It would be 3, right? So this is a way that there's a lot of meaning in the terms of anatomy that can really help you just understand the function of that structure or the location of that structure or so forth. Same thing with if I say the piriformis, this is a muscle in the hip region, and this is a pear-shaped muscle. That origin of that term will be coming from the word pear. Okay, levator scapulae. What do you think that muscle does? What's its action? Yeah, lift up the scapula, right? Levator scapulae. Its action would be to elevate or raise the scapula. Okay. All right, we have to think about anatomical variations. So this is important as well. There can be different structures that are presented differently, just general variation across the human species. So you'll see some of the common ones, we'll talk about those. What I will encourage you and mention when we bring those up is what is the most testable format of that, so that you're clear on what to expect from your exam, right? So there are different diseases, or structures rather, where a vessel may have different origins depending on different racial groups, different geographic groups. Okay, let's begin with the anatomical position. So this is the reference point that we think about the body being in whenever we describe an action, any function, or any location. So how would you describe this position? How would you, just looking at the image here, how would you describe this position? Yep, so it's called the anatomical position, but how would you just objectively describe it? So the patient is erect, first of all. They're not supine or prone, right? They're not inverted, they're erect, right? Hands are adjacent to the sides, palms facing forward, feet facing forward, right? All of those are in the same plane. And then at the forearm, we specifically have supination instead of pronation. All of the hinge joints are in extension. So think about the elbow, extension, knee, extension, hip extension, and this would be how we describe the anatomical position. okay? The facial expressions will be relaxed. Again, this is a standard reference point to discuss some of those muscles and how they act. And the palms, as I mentioned, facing forward, pads of the thumbs turn to 90 degrees, and then toes facing forward. So this is that objective anatomical position. Now we can think about three major planes to divide the body. These become important, especially with imaging, to think about what plane that view was taken in, or what plane that image was created in. So we have a coronal plane. This divides the body into anterior and posterior parts. Okay, so that would be the panel in the center here. This is your frontal or coronal plane. So this can be closer to the back or closer to the front, but just that plane going from top to bottom, giving us anterior and posterior parts, would be the frontal or coronal. Then we can think about the sagittal plane. And this one gets a little tricky because sagittal can be any slice taken that divides the body into medial and lateral parts. But more specifically, the median plane, that would be right down the middle, okay? So if we were to divide the brain, for example, along the median plane, it would be right down the center of the brain, and you can see some of those really central position structures. So that was the sagittal, anything parallel to the median, and then median right down the middle. Okay. Lastly, we have the transverse, also called horizontal, also called axial. Okay, those are all alternate terms, and that would be a cross section. Okay. What type of imaging would you think would be divided or viewed in a cross-sectional plane? Any thoughts? So a CT is a good example, right? So a CT would be a cross-sectional view typically. You can have different views, but that's typically a transverse or cross-sectional view. Terms of position. So here's where we get to see terms. I'm sure we use these in everyday language, but again, these are objective terms that we use to describe certain regions and structures in anatomy. So anterior would be anything to the front of the body. This is also called ventral. Posterior would be anything to the back. That is also called dorsal, excuse me. So anterior versus posterior, ventral versus dorsal. What are some structures that are anterior? Sorry,
Anterior pituitary gland.
Okay, anterior pituitary gland, excellent. So that would be anterior, and then posterior pituitary would be posterior. Okay, excellent. Medial, lateral, similar terms. Medial meaning closer to the midline, lateral meaning further away from the midline, outwards to the sides of the body. So I could say, for example, the arms are lateral to the trunk, or I can say the nose is medial to the ears. Superior, also called cranial. This is anything closer to the head, right? So I can say that the clavicle, like the collarbone, is superior to the abdomen. Okay, this is an example. And then caudal or inferior would be closer to the inferior or the feet, and that would be, again, a reference point used to distinguish two structures. Proximal, distal, this one is really specific to the limbs. All right, so proximal is closer to the origin of the limb. So think about your shoulder being proximal to your elbow, and then distal would be further away from the origin of the limb. So your ankle joint, for example, is distal to your hip joint, distal to your knee joint. Okay, some more paired terms of position. So superficial, intermediate, deep. This is a concept of depth. So if I'm thinking about the bone, what are some structures superficial to the bone? Sorry? Bone marrow, would bone marrow be superficial or deep to the bone? It would be deep, right? What would be superficial to bone? Fascia, excellent. So fascial layers, fascial compartments. What else? Muscle, yeah, muscle would be superficial to the bone as well. Okay. Then we have, in terms of the hand specifically, palmar and dorsal. Palmar is the palm surface, the inner surface. Dorsum or dorsal is the back of the hand. For the foot, it would be plantar and dorsal. Plantar would be the sole or the underside of the foot, and then dorsum would be the back of the foot. Left and right, this one is pretty intuitive, right? Left of the patient or structure. So remember, this is not your left and right, it's the patient or structure left and right. Unilateral versus bilateral. What does it sound like it means? One or two, excellent. So is the structure appearing in a singular fashion, or is it a paired structure? Ipsilateral versus contralateral. This one's specific to the nervous system usually. What do you think this one means?
Neurons stay on one side of the possibly the other.
Excellent, excellent. So do the neurons supplying a certain region originate in the same side that they're innervating, or are they crossing at some point along the brainstem or the spinal cord? Perfect. All right, terms of action. So this is where we think about movements that are happening, especially across joints. So the first two are flexion and extension, especially at our hinge joints, like the elbow joint. Flexion is decreasing the angle, bringing the forearm closer to the arm. Extension is the opposite, right? Opening up that angle at the joint. Abduction versus adduction. Abduction is bringing away. Think about that AB, away from body is a mnemonic that I like to use, away from the body, AB. And then adduction, adding or bringing it closer to the body would be the opposite movement. We can also see abduction, adduction with the fingers. And this is going to use the middle finger as a reference point. So bringing all 4 digits closer to the middle digit is adduction. Moving the 4 digits away would be abduction. Okay, for the thumb specifically, abduction and adduction take place in a slightly different plane. So adduction versus abduction, just because of that positional change for the thumb. And then flexion extension can happen at the digits as well. Let's look at supination, pronation. This is specific to the forearm bones, the radius and ulna. Radius is a lateral bone, ulna is a medial bone. When the radius rotates over the ulna, this is called pronation, and then this would be supination, right? One of the ways I remember this is drinking soup versus pouring soup, right? So supination and pronation. Other two terms, dorsiflexion and plantar flexion, are relevant to the ankle joints specifically. So dorsiflexion is toes off the ground, toes up, or heel on the ground. And then plantar flexion is the opposite, toes on the ground, heel off the ground. So standing on your tippy toes. So which of these actions might a ballet dancer typically be in when she's standing on her toes? Plantar flexion, excellent, plantar flexion. And then also happening at the ankle joint, eversion and inversion. So this is referencing where the sole of the foot, the plane in which the sole of the foot moves. Inversion, moving inward, and then eversion would be moving outward. Okay, let's look at some of the regional lines. So we want to think about those that are anterior first. If you look at someone objectively in the front of the body, there are certain lines that we can use to divide certain bones or structures. These are called our regional lines. The first is the parasternal line, and this is vertical. It's at the front of the thorax, and it's right adjacent to the sternum, right? Hence the term parasternal. So that can be a good way to think about dividing the thoracic cavity, and again, right adjacent to the sternum. Lateral to that is the mid-clavicular line. So it's going to be midway across the clavicle. Right, the clavicle being your shoulder bone, right along the center of that bone would be another regional line with clavicular. This one is important when we think about listening to the valve sounds, right? Listening to the heart, doing our physical examination, and we would go mid-clavicular line along a certain rib space to really get to where those valves can be auscultated. Lastly, or not lastly, sorry, we've also got the anterior axillary line. So right on the anterior surface of the axilla being the armpit region, and then there's also a posterior axillary line that we'll see on the other side as well. And the last one on the anterior would be the umbilical pelvic line. There's a plane that goes from the ilium bone right across the umbilicus, and that would be umbilical pelvic. All right, the posterior regional lines would be the paravertebral, so similar to parasternal, just on the adjacent side of the vertebral column or the spine. Okay. Then we have the scapular line. Right along the midpoint of the scapula would be the scapular plane or scapular line. And then, as you mentioned earlier, the posterior axillary line would be adjacent to the axilla on the posterior side. And then the iliac crest. So this one is really important when we're thinking about the symmetry of the spine, looking at the prominences of the iliac crest to determine if they're in a straight line or if there's any scoliosis, right? So there's some asymmetry to the spine. This can be used to help us make that determination. All right. Let's look at a practice question here. So let's put that top hat to the test and see if you guys can get it. So I'm going to start the question. Okay, give it a try and let me know if you have difficulty getting your vote in. You can't get it at all? Okay, so we'll just have to do this manually. And I'll figure out why this isn't working. Okay, so let's just discuss it. So we have a woman, notices poison ivy on her shoulder. She reaches her right hand over her left shoulder to scratch the itch. Which of the following movements occurs at her right elbow joint? What are we thinking? Apparent flexion. Anyone disagree? Okay, so that is correct, right? This would be flexion happening at her right elbow joint in order to scratch that itch on her left shoulder. Okay, it looks like 4 of you were able to vote. Okay, and most of you did select C. Okay, let's look at another question. So here we have a tap dancer tapping her feet as a part of a dance routine. Her toes lift off the floor in an upward motion while her heel remains flat. Which of the following actions best describe this ankle movement? Dorsiflexion, that's correct, dorsiflexion. And you guys didn't even need the answer options. Dorsiflexion is correct. Okay, it looks like some of you are able to vote. Who is submitting a vote? We have people that didn't work on. All right, so I will look into that further and make sure that you guys can access this next time. But some of you may have done the free trial, and that may be why some of you can vote. All right. Okay, let's look at another question here. I'm going to make this a little bit bigger. I'll let you read the question first and then I'll make it a little bigger. Okay, so a pathologist student is asked to take a slice a brain specimen in the frontal plane. Which of the following specimen is he observing after making this cut? So if he's asked to take a frontal section, which of these are we thinking? Okay, so B is correct, right? So this would be along the frontal or coronal plane, giving us anterior and posterior parts. What would A be? What would A be? Median, yeah, median. What would C be? Transverse or axial. What would D be? These are a little tricky. Sagittal, right? So not quite the midline. Okay, and as we get into the brain, this will make a little bit more sense, but it's sort of parallel or adjacent to the midline. But if you look at A, you can see right down the midline, and we'll talk about what these prominent structures are that'll help us make that decision, okay? So it looks like most of you went with B. B is correct. Okay, I think we've got one more. Okay, so which of these is accurate if we are describing the body in the anatomical position? Okay, so I'm hearing C, the forearm is in supination. Okay, that is correct, right? And we can easily eliminate some of the distractors. See if that's what everyone voted for. Okay. So some folks said B. Remember, when we talk about the anatomical position, there is no movement or change happening at any joint. The joint is in a neutral position, neither plantar flexion nor dorsiflexion is happening. So C would be the correct answer here. Okay. Okay, let's move on to the anatomical regions. And these are really sort of point and shoot. These are areas of the body that we typically are familiar with, right? The head, the foot, the ear, that are in our everyday language, but there's a medical term or a specific term for that region, and we'll talk about what those are. So the cephalic region is the head region, okay? The occipital region would be specifically what? The back of the head, right? What about the front of the head? The frontal, right? This is the frontal bone, we've got the frontal lobe here, so this would be the frontal region. What about the ear region? Otic, right? Otic would be the ear region, okay? Orbital would be the eye region, all right? The nasal region typically will be referred to as the nasal region, that's kind of standard. The buccal region would be the cheek. We'll talk about the buccinator muscle, but that will give that name, or region its name, which would be the buccal region. The mental region would be the chin. Okay, when we get to head and neck, we'll talk about the mental nerves, mental lymphatics, those will be referring to the chin. The cervical region would be the neck. I think that's again a pretty standard term that we use, but that would be the standard or term rather to refer to. Let's look at some of the thoracic regions. So the scapular region would be right along the shoulder blades. That's kind of the layman's language or term that we use. The vertebral region would be the spine, right along where we have that vertebral column. The acromial region will be the shoulder. And the word acromion, we'll talk about this part of the scapula, that means highest point, right? So acromion or acromial is referring to the highest most point of the limb, which would be the shoulder. The sternal region, that would be along where the sternum can be found, or the breastbone, sometimes referred to as. The axillary region would be the armpit. The abdominal region, kind of the general stomach area. It's funny in everyday language we refer to this as the stomach, although the stomach is really an organ, right? It's an organ inside the abdominal cavity. But this would be the abdominal region. What would umbilicus be? The belly button, right? That central region would be the umbilicus. The thoracic region would be the general chest area. So that's kind of where we have the thoracic cavity, lots of important vital organs there. And that will have the ribs and the muscle cartilage. The lumbar region will be the lower back, so specifically along the flanks or the waist, but in the posterior region. Well, I think we missed the mammary region. So the mammary region would be a specific part of the thoracic region where we have the mammary glands and then the pectoralis muscles. Okay, let's look at the abdominal region. So we can think about dividing the abdomen into 9 areas, or sometimes 4 quadrants. Some literature will just divide into 4 quadrants. but we have the epigastric region, and epi means above, gastric means stomach. So internally, when you think about the epigastric region, it's gonna be right above where the stomach is. Umbilical region will be lower to the epigastric region, again around the belly button from the surface anatomy standpoint. Hypogastric region will be below the stomach and below the intestines, which we have here. And then the lumbar region will be on the sides of the umbilical region. So again, think about the flank areas. This would be your left lumbar, right lumbar. The iliac regions will be in the lower right and left sort of quadrants, if you will. So here would be your left iliac, here would be your right iliac. Can anyone think of an organ that could be found in the right iliac region? Appendix, yeah, this one is often inflamed, and so there's typically surgery involved in this region. That would be in the right iliac region. Let's look at some of the pelvic regions or gluteal regions. So pelvic would be just inferior to the belly button, to the umbilicus. Lower to that would be the inguinal region. This is getting into the groin area. Okay, this is where we have the bladder in the inguinal region. Then we have the pubic region, which is even lower to the inguinal region. This is where we're getting into the genital area. And finally, the perineal region, this is the area in between the genitals and the anus. So right at the lowest point of the pelvic cavity, externally, that would be the perineal region. If we think about the upper extremities, again, the acromial region we went over, scapular region, we've got the brachial region. So the arm would be the brachial and the forearm would be the antebrachial. Okay. The elbow area, the surface of the inner elbow, will be the antecubital region. What's something clinical that happens here, the antecubital region? Yeah, we draw blood at the antecubital region. Excellent. And then we've got the olecranon region, which is the elbow, pretty much the back of the elbow. We have the olecranon bone there, a really prominent bone. Anyone know that bone is sometimes called funny bone? Yeah, so the funny bone, we'll talk about the nerve that creates the sensation that gives that structure that name, the ulnar nerve. All right, the hand region, so again, palmar, the inner surface, dorsal, the posterior surface. What about the wrist region? What's this typically called? The carpal region, right? The wrist area, we have the carpal bones here, and so that would be called the carpal region. The pollex would be the thumb. So we'll talk about a lot of muscles that have pollicis in the name, adductor pollicis, pollicis longus. That is going to be a muscle that moves the thumb. The digital region would be the digits themselves. We'll talk about the phalanges, or the bones that form the digits, but the region itself would be the digital area. The lower extremity or gluteal region, first we have the pectoral region. This is going to be the shin area. The patella region will be where we have the kneecap or the patella bone. The fibular region will be the lateral leg, and then the sural region will be the posterior part of the calf, right? Posterior part of the leg. Popliteal, very important area, lots of important neurovascular structures here. This is sort of the back of the knee, okay? And the muscles here form this nice diamond-shaped opening, which allows those vessels to leave the thigh and go down into the leg. That would be your popliteal artery, vein, etc. And then the gluteal region is the buttocks region. So this is essentially made of the gluteus muscles, which is maximus, minimus, medius. We'll talk about those. Lastly, the foot regions. So very similar with the hand, the foot has a tarsal region, which is the ankle. This is where we have the tarsal bones, okay? The calcaneal region is specifically the heel. So that large bone that forms a rounded projection of the heel is called a calcaneal bone. And then the hallux region is the great toe or the big toe. Again, lots of muscles that will be hallucis longus, hallucis brevis. These are going to be muscles that move the great toe, while the digital region will be similar to the hands, will be the toe area. The plantar will be the sole, and then dorsal will be the foot.